You have questions, we have answers. Back with another quick clip. We had a question that came in regarding Medicare, and I know you have a deep background in Medicare. And the individual has just turned 65, they're turning 65, they're still working, they're covered by their own employer healthcare covered plan. And he's reaching out because he's being told by friends of his that he needs to sign up for Medicare right away. Otherwise, it's going to cost him in the form of penalties and things of that nature. Can you talk a little bit about that?
Sure. So he does not have to sign up for Medicare if he has employer-provided coverage, either through his own employer or even through a spouse's. This is a common misconception. You can keep your employer-provided coverage as long as you're working, regardless of your age. This gentleman could go ahead and sign up for Medicare Part A, which is free. Part A is the hospital portion of Medicare coverage. But Part B, which is everything else, doctors, outpatient care, medical equipment, x-rays, that kind of thing, services, does have a fee. It's a monthly fee of about $144. And so you don't want to double up on what you're paying for health insurance by starting Part B and paying that $144 and also continuing to pay for your employer-provided health insurance.
Yeah, if you already had the coverage, why pay double? And then the question becomes, if you're going to sign up for Medicare A, is there anything that folks should know?
There is at least one thing to keep in mind. Once you have signed up for Medicare, even if it is just Part A, you're no longer eligible to contribute to a health savings account. So that is something to keep in mind. A health savings account is a terrific way to reduce your current income because contributions go in with pre-tax dollars, and then also set aside tax-free money to help pay for healthcare costs in retirement. And people who continue to work past age 65 and delay their Medicare enrollment do enjoy the tax benefits provided by a health savings account and like to contribute to those for as long as they can.
Yeah, for those of you that aren't familiar with these HSAs, sometimes they're referred to almost as Roth IRAs for healthcare expenses. They're just that powerful, and they can be triple tax exempt and things of that nature. So it's an excellent point to be thinking about. I know just before people turn 65, they get a ton of literature regarding Medicare, sign up, some of the rules as it relates to Medicare. It's confusing. Is there can you spend a minute, just a basic overview on that process?
Sure. Medicare is confusing. It's kind of an alphabet soup. You've got your A and your B and your C and your D, and you need to know about all these. So we become eligible for Medicare at age 65, and we can sign up 3 months prior to that birthday. You can go online to the website, medicare.gov, and sign up for both your Part A and Part B. But then comes another choice that you have to make. Do I sign up for a Medicare Advantage plan or a Medigap supplement? And what are those? Do I need them? You really do need them. Why? Because Medicare only covers 80% of our healthcare costs in retirement. So there's this 20% gap in coverage. And you really need to choose supplemental coverage for that gap. I mean, imagine if you had open heart surgery and trying to come out of pocket for 20% of that high cost, and that could bankrupt somebody. So you want to look into supplemental coverage. So the Advantage plan is like an HMO. You pick a health system and you stay within that system, those providers, those facilities, and that's where you get all your care. A Medigap policy, on the other hand, allows you to choose any providers, any facilities that you want for your coverage and care, as long as they accept Medicare.
Yeah, to your point. I mean, it gets complicated trying to come out with that money out of pocket with some of the gaps that are built into the program. it makes sense to insure against that and pay a little bit more for the peace of mind and the coverage. Lisa, I appreciate you being here. Again, this is interesting material for a lot of folks to be aware of, even before they turn 65. Medicare can be complicated and it can be costly, assuming that you don't choose correctly or that you're not ready to make those decisions on the right timetable. So very much appreciate you being here, appreciate your background. So thanks for joining us today.
Oh, you're welcome. Happy to do it, Brian.
If you or anyone else has questions they'd like answers to, please feel free to go ahead and email us at qa@MarrinerWealthAdvisors.com. Thanks for watching.